See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shawna Butler.
When it comes to health and well-being, there are certain leading indicators that serve as the proverbial canaries in the coal mine, vital signs that we monitor regularly to detect early stages of disease. Things like blood pressure that can alert us to our risk of stroke, heart attack, heart failure, kidney failure, and weight, body mass index. Those alert us to the risk of developing diabetes or heart disease and cancer. On this episode of See You Now, we talk about something less obvious but just as significant when it comes to barometers of health, and why we don't think of it as readily as we should.
Actually, what you're talking about is something I call the Great Divide. Like, when did we divide the mouth from the body? And a particular area of interest of mine has been in pneumonia prevention in hospitals.
In this wide-ranging conversation with professor, nurse researcher, and former school nurse Dian Baker, we learn how to prevent hospital-acquired pneumonia. And as if that wasn't enough, we talk about kids at school, people in hospitals, prenatal care, the microbiome, data, antibiotic stewardship, and how it all relates to our mouth and the surprising technology and near miraculous impact of the toothbrush.
You know, you're sick, you're tired, and you don't know it's important. We have not informed the general public about the importance of oral care. I mean, even loved ones could help with this in the hospital. They'd probably be happy to if they had the right kind of toothbrush and a good toothpaste and a way to provide oral care. They would be very helpful to the nurses.
We also hear about Diane's mission to improve the nation's health by putting more nurses in schools and more toothbrushes in the hands of nurses. I'm Shawna Butler. Stay with us. Tell me about Dian Baker, the nurse, the educator, and the researcher.
Currently, I am a professor of nursing at Sacramento State University here in Sacramento, California. I've been here for about 20 years, full-time faculty for about 15. Prior to that, I was a school nurse, a pediatric nurse practitioner, worked in maternal child, public health. I mean, one of the most beautiful things about nursing is that you can practice in so many ways, in so many different environments, and have impact on so many groups of people. I just think it's beautiful.
I agree, and I'm glad that you shared that breadth and the opportunities to be intervening in people's health at every stage of their life and in every setting. I've been observing and discovering in conversations with a broad range of professionals who are looking at public health and looking at the health of people and citizens who are not in traditional healthcare environments is we don't work well together as disciplines. And specifically, one of the things I just am always surprised by is how limited we are in working with our dental professionals. It's a different record. It's a different funding model, a different insurance model, a different training discipline, and yet somehow or another, I don't think our mouth ever got separated from our bodies or our health. So I always just kind of laugh at that, and I think we've done such a great job of teaching the message of oral hygiene, brushing your teeth, flossing regularly, going to get a dental exam, and so we've got a lot of people across the country who are regularly going in for dental visits, but we haven't really tied in our medical exam, our health exam to our dental and eye exams. So you've probably spent an awful lot of time in your research looking at this and seeing where we're missing the boat and what the opportunities are. Can you say more what you've seen in your research?
Yes, actually what you're talking about is something I call the Great Divide. Like, when did we divide the mouth from the body? And a particular area of interest of mine has been in pneumonia prevention in hospitals. So this is a primary safety issue for every patient coming into the hospital. If a patient acquires pneumonia in the hospital, we refer to that as hospital-acquired pneumonia. It is now the number one hospital-acquired infection in the United States. This was reported by the CDC in 2018. Unfortunately, to date, there have not been regulatory requirements for hospitals to monitor or intervene to prevent this type of pneumonia. It's very serious. 1 in 5 patients, or about 20%, will die when they get hospital-acquired pneumonia. And it's costing the healthcare system in the United States literally billions of dollars in extended stay, antimicrobial usage, which would not otherwise be necessary, and other types of patient harm. So what does that have to do with the mouth?
I'm so glad you asked,
yeah.
because those are some pretty big numbers that you just shared.
Yes, absolutely. Well, here's the key. Pneumonia comes from germs in the mouth. And we all have lots of germs. We have about 200 million microbes that live in our mouth. And for the most part, as long as we're brushing our teeth, eating, talking, they balance themselves out pretty nicely. And there's little harm that comes. However, when we walk into the hospital, that all changes. We do several things that disrupt that normal flora of the germs in our mouth, and it begins to shift toward health-harming bacteria. And as those health-harming bacteria flourish, all of us do have a little bit of slippage, what we call micro aspiration, very tiny nanoparticles that slip down into our lungs. Again, in a healthy adult, not so much of a problem. But when you're in the hospital, you're compromised. You're given medications to dry out your mouth. You're put in bed. You're immobilized. Sometimes you're put tubes down to your lungs to help you breathe. And then nurses do not have adequate time to ensure that that oral microbiome is maintained by toothbrushing and oral care during hospitalization. In our study, we found out that patients are getting oral care about an average of once every 3 days, and that is nowhere near enough.
Wait, did you say what? Oh my gosh! Oh, I mean, let's face it. When you are post-operative in a post-operative situation, you've got IVs in your hand. Your arms sometimes are like constrained in a lot of different ways. You might hurt. You might not be able to feel something. You've got nasal oxygen. You've got tubes in your mouth. I mean, there's a lot that gets in the way. So it does make sense why that would happen. But
absolutely. Yeah. And you're sick, you're tired, and you don't know it's important. We have not informed the general public about the importance of oral care. I mean, even loved ones could help with this in the hospital, and they'd probably be happy to if they had the right kind of toothbrush and a good toothpaste and a way to provide oral care. They would be very helpful to the nurses. Nurses in general are not aware of the association between germs in the mouth as the primary source of pneumonia. So without that knowledge, they're really limited in being motivated to even think about this. And nurses have a lot to do. So why would they put oral care at the top of their list when they haven't been informed about this critical harm and something that's very dangerous? And why did that happen? Because we have separated the mouth from the body.
Yeah, I'm playing through that scenario in my head of being in the ICU and of all of the things that I need to make certain of and thinking about the criticality. You're right. We don't make the connection between a critical measure and intervention, something that we can actually do or invite other family members to do or invite our patients to say, let's make sure in all of your care, let's make this a priority. And that's something definitely that they can. I think there's also that sense of helplessness that when you are in that situation of feeling terrible, of having limited mobility, it's hard to ask for help. And so this might be one of those activities where we're giving them the responsibility and the opportunity to say, this is one thing I can take care of. I got to have somebody help me up back and forth to go to the bathroom. But, this is something I can do all by myself.
Yes, a very important thing that all patients and their family members could take on and help take responsibility for, except in the case of patients that, say, have severe disability or maybe they're immediate post-stroke where they need the nurses to use a special suction-type toothbrush to prevent further aspiration. But about 80% of patients could manage this on their own if they knew, if the nurses knew, and if they had the right equipment in an easy location and a good way of recording that this is being done. There's a long way we can go toward getting this fundamental aspect of care back in place in hospitals and help stop the number one hospital-acquired infection.
So what is it that you're doing to decrease that knowledge gap?
I've been working across the country with several hospital systems that took note of the 2018 CDC report about pneumonia and have contacted me. So we've created a SOURCE toolkit, which is hospital-acquired pneumonia prevention. And it lists several things that hospitals can do to get started in taking action under the direction of nursing leadership and really thinking through basic infection control. For every type of infection we want to control in the hospital, we start with primary source control. And when you ask this question about pneumonia, that primary source control is going to be keeping the mouth clean, just like hand washing.
I was doing some research on this, and I love the very simple directive, rush to brush. How did you come up with that?
That actually is not something that I came up with. That is from the Aetna Health Insurance company, and they also contacted me. We had great discussions. They were quite interested in keeping their members, their Aetna members, safe during their hospitalization. So they are in the process of sending out oral health information, the importance of brushing, and kits to help patients brush their teeth before hospital, during hospitalization, and afterward. And their program is called Rush to Brush.
But the basics of this are making sure that you've got a toothbrush and toothpaste. Probably for many people, it might be that they're not actually able to brush, that there's some type of an oral rinse, something that they can swish around and spit out. It's more the intention, because none of these tools are things that are outside of what people generally use. They're readily available. It feels like this is a behavior and a mindset and a priority.
Well, I like to say that there's no such thing as a simple solution in a complex system. Certainly, toothbrushing is a simple solution, but you're dealing in an incredibly complex system. So, for example, in a typical community hospital, you probably have 2,000 nurses working and another 1,000 or so nurses' aides. That's a lot of people to educate, have them rethink their practice, reprioritize how they manage their workflow. Even things like a toothbrush. Well, most hospitals have toothbrushes, and they will provide those for patients, but the bristles fall out. Nurses are embarrassed to use them. They're ineffective. Most hospitals have these pink foamette swabs available. They do nothing to get the germs out of the mouth, and yet nurses will rely on those. So you have to really think about everything within that system that needs to change so that the nurses have their best opportunity of being able to implement that simple solution.
When you point out all of those details, you're absolutely right that even in that simple solution that there are multiple barriers that you just identified. How are you thinking about this so that each one of these barriers that you've identified, what's a good approach to remove those barriers?
Well, the first step is to engage nursing leadership and to have nurse leaders look at the system and how fundamental nursing care is delivered and all the different aspects of what's necessary at each individual hospital, because they all operate differently. They all have different needs. There's different cultures. It's not going to be a one-size-fits-all. We know what needs to happen, but how it's going to happen in your organization is going to depend primarily on nursing leadership, getting them engaged with the problem, and that's what I've been trying to spread the word about. Because once they know what to do, we have a lot of tools to help them get there.
So why have you identified nursing leadership as opposed to going to the respiratory group, pulmonologists, the surgeons? Why specifically nursing leaders?
Because nurses are at the bedside, they're engaged with the patient, they're the primary group of professionals in the hospital that are seeing the patients on a daily basis, and their charge is to maintain the patient's homeostasis, their health balance while they're in the hospital. That said, everything is a team effort, and all the other professions that you mentioned actually have been part of advisory committees with us as we came up with these solutions. We have certainly taught respiratory therapists, speech and language therapists how to do oral care, and they've been happy to do it when they found out how important it is.
Yeah, and I would think that the other departments to engage in that would be food services, nutrition services. I mean, we're always taught, brush right after you eat. That might, there are opportunities there as far as working it into the existing routine. And my experience has been whenever we want to introduce a new behavior, if we can introduce it to an existing routine, it's more likely to be adopted as opposed to, now I'm going to give you one more thing that you need to do. So you started out with, as far as removing these barriers, that first one was engaging nursing leadership. What are some of the other barriers that you have an idea around?
So for example, I mentioned about how individual hospitals need to come up with their own solutions, and I've seen a lot of creative ways that barriers have been overcome. And piggybacking on your thought about with meals, so our goal is to brush teeth after every meal and at bedtime. And so nurses have worked and engaged with supply chain about getting oral care supplies out on the food tray. And the food tray mat that sits under the food actually says, brush your teeth, and has a checkbox for brushing it after breakfast, lunch, and dinner. And working with food services, supply chain, and nursing together, that goes right out with their meal. And that absolutely results in high success rate.
Yeah, I can see where that would be fun. And there's nobody more engaged or at greater stake than this than the person who's having the surgery and the people who love them. How are you engaging patients and family members preoperatively, intraoperatively, and postoperatively?
We have worked with patient and family advisory councils to look over our educational materials and help us design programs to do that. Primarily, we're reaching out with families and patients by giving them educational materials before their surgery, immediately after their surgery, and in follow-up. I know one of the local hospitals here has a very clear line item that says, brush your teeth. So here's these 4 things you need to do before you come into the hospital. And number 4 on that list says, brush your teeth. So giving patients information is giving patients power, and working in partnership with them, we can solve this problem.
So in the places where, I guess there are different hospitals where you've implemented this, what have you seen as far as results, and how long did it take to get those results?
We have some pretty phenomenal results. One of the local hospitals here reduced their hospital-acquired pneumonia by 70%, saved the hospital system over $6 million in 1 year, and more importantly, 32 preventable deaths from hospital-acquired pneumonia were predicted from the data. That's a lot of lives saved and a lot of money. Kaiser Permanente in Northern California implemented hospital-acquired pneumonia prevention, emphasizing things like oral care along with a very strong mobility program. They have reduced their hospital-acquired pneumonia by 40%. Veterans Administration has now taken this on nationally with their hospitals under the direction of Dr. Shannon Monroe, and they have seen phenomenal results, up to again, 60 to 80% reduction in hospital-acquired pneumonia, preventing hundreds of deaths among our veterans in the United States. So when hospitals take this on and nurses take this on, we know we can get results.
Well, you say that very calmly, and I feel like we need to have a standing ovation. I mean, when was the last intervention? What was the last intervention that you can think of that had that dramatic a result? Well done. And you're right, it has been a team effort. And how likely, or what does it take to get organizations to embrace your ideas?
Well, one of the biggest barriers we have, and in some, well, I'm not even sure I would describe it as a barrier. Hospitals are under a lot of pressure to meet demands that are issued through guidance agencies such as CMS, the Centers for Disease Control, accreditation agencies like the Joint Commission. Sometimes there's around 400 quality standards that they have to meet. And so by their very nature, they're going to pay attention to those things. That's what they get paid for. And in some cases,
it's also
if
what
they
they
don't
get
do
penalized
well,
for, yeah.
Yeah, or they can get penalized for. And so when we try to point the arrow toward the number one hospital-acquired infection and say, you have a problem with pneumonia, and this pneumonia is resulting in a 20% mortality rate, they kind of look and say, well, it's not on the list. Until we get national push through regulatory and accreditation agencies, I think it's going to be difficult to get a national level response on this. That said, there certainly are numerous hospitals that are starting to pay attention, administrators and leaders that realize this, and they're not waiting for those directives. They're taking action. And I've probably consulted with well over 100 hospitals at this point individually that are taking action, and they should be highly commended for doing this.
Agreed. And is it because we're not collecting the data, we don't have visibility into the data, we're not sharing it? What's the data issue on making sure that decision makers are aware of the potential impact that this can have?
Well, that's actually at the core of the problem, because there's no requirement that data is collected on this at all or reported. And so that's been our ask from the CDC and the Joint Commission is, let's just start there. Let's just say that hospitals should be collecting this data, because I think once they see it and they see the cost and the patient harm, they will take action. And then they can tailor their interventions and the action they want to take to their unique hospital system and culture. But they don't even know that this exists. It's a huge hidden harm. And patients don't know it.
Agreed. I was going to say, I just don't think that people in the general public, when we think about our public health education, we're very good about talking about the harms of smoking, the harms of drinking while pregnant, the harms of drinking while driving. I don't know that we've had that public message of not brushing your teeth when you're hospitalized. I'm looking and thinking, what does that campaign look like? And how do we get the actors from Saturday Night Live to popularize this and bring it to life in one of their skits?
I would love that.
Yeah, I think, well, you're out in California. You've got the creative industry there. And I do think it's really interesting the role that the creative industry does have in this. When we think about some of the public health messages, when those habits are put into a character's script and we see certain behaviors. I'm trying to remember, there was a colleague of mine who was looking at putting together film festivals on difficult conversations and what are the films that have been done looking at a diagnosis of cancer or Alzheimer's, AIDS, loss of a child, any number of those things. And it was really interesting to see the role of our storytellers in helping to create a public health message. And so I'm thinking that Diane, this is the moment. We need to have the Julia Roberts moment of teeth brushing,
Yes, I absolutely agree. I was talking to a person who does media and film a few days ago, and he said, You have to make brushing teeth in the hospital as important as brushing teeth on a first date, and think about how that's been played out in movies and really helping people see the importance of it. I thought it was a pretty good idea.
You're listening to See You Now. I'm your host, Shawna Butler, and we're talking with nurse, researcher, and educator Dian Baker. When you were talking about use of antibiotics, so we are seeing antibiotic resistance. It's been listed as one of a global threat, that increasing use and how more and more antibiotics become less effective, and we're developing resistance. How does something like this really help us to get at that much bigger global problem?
Well, pneumonia prevention has a big role in antimicrobial stewardship. If you take a step back and think that it's the number one hospital-acquired infection, by default, it's going to be the number one reason, infectious reason, why antibiotics get prescribed in the hospital for a hospital-acquired condition. Most patients with pneumonia will end up on at least 2, if not 3. Sometimes, if the patient is pretty ill, they're going to be prescribed some of the higher level antibiotics in doses that are really looking at millions of doses across the United States. And if we can begin to even tap down hospital-acquired pneumonia by even, say, 20%, think of the millions of antibiotics that will not be administered and the millions that will not be interfacing in this resistance problem. This is a direct story connect, and thank you for asking that question.
Yeah, I was going to say that it was interesting to me when we look at global threats that I think that that's been listed by the World Health Organization as number 2. It is really high, and I don't know that we do make that connection in all of these different ways. Oftentimes we think about inappropriate prescribing, where somebody comes in and I've got a sore throat, and prescribers share that they feel pressured to prescribe something, but a pneumonia is a absolutely correct prescription for it. So the question is, how do we prevent that appropriate use? And you've identified a brilliant, simple, inexpensive, low-tech way to do that. So you're seeing, and most of your research has been in hospital-acquired pneumonias. What are you seeing outside of the hospital where this understanding of better oral hygiene can prevent infections?
Well, the relationship between oral health and several systemic diseases is beginning to be established in the research. One that's of particular interest to me is premature birth and poor oral health. We know that when pregnant mothers have inflamed gums and infection going on in their mouth, and you might not even realize you have it. So you brush your teeth and their gums are bleeding a little bit, or they look a little red. You're not realizing you actually have an inflammatory process from poor oral care going on, and we know that that is associated with preterm birth. So we could go a long way toward handing every mother a toothbrush kit and discussing oral care at one of their prenatal visits. Every bit as important as that folic acid and the other types of prevention. That is not yet happening widely. There's a relationship between diabetes and glucose control, heart disease, inflammatory heart disease, and oral health. But one thing that's of even, I think, more interest to me and has been a passion in my life is children's oral health. When I was a school nurse, number one reason at the school nurse office was unaddressed cavities, gum, swelling, infection. I saw so much of it, and I really worked with the county public health department to bring in a lot of new oral health programs into the school, including dental mobile vans. We taught school nurses how to put sealant on teeth. I designed new lessons for math and reading that incorporated the importance of oral health and teeth counting in math. I just can't emphasize it enough. Our mouth is part of our body and it's essential to our health, whether you're in the hospital or not.
I am a huge fan of school nurses. I would love for you to say more around the children who get lost in our school systems, children who they have special needs, they have different needs, and it seems to me that it has been the school nurses that help find them.
Now, I ended up gravitating towards school nursing because I was working in a clinic as a pediatric nurse practitioner, and I would see the very children that you're talking about, those that seem to not be thriving in health or with their education. And it occurred to me that if I wanted to try to have impact in that population and to really provide service, that I needed to be out where it was happening. And that was in the schools. It's kind of the perfect intersection between school and health. You can only be as healthy as you are educated, and your education so much depends on being healthy. You have to be able to be in school, be healthy to learn, and who's the person that's at the epicenter of that? That's the school nurse. Highly underutilized profession in terms of public health in the United States, particularly for those children that are missed. For example, we know about 40% of mental health services occur in schools because it's the only place that it can occur given our dysfunctional mental health service system. School nurses are often the first one that pick up on children's developmental needs, barriers to education, fighting to get them insurance, making sure that when they come to school that they have food. It's a very broad and with lots of potential. We could improve the health of our nation, I'm quite convinced, by 1,000-fold if we would put a school nurse in every school. And I know that from 15 years of practice and the difference that I was able to make in children's lives, families' lives, and often in many cases in the teachers' lives, who I also provided a lot of services for.
Yeah, that's part of this that with school nursing that we often leave out, the services that are provided to faculty and to staff in the schools. Mm-hmm. And you're talking about mental health services and picking up on needs that children have. Can you more specifically name them? What does it look like? What are you seeing?
So here's a typical Monday morning. You're in the school nurse office, and at the age of, I'm going to pick elementary school to start with, a child comes in and they have a stomach ache. And they start telling you about itches and rashes and describing the symptoms that are really related to high anxiety. They may come in and start talking about how sad they are, but many times these are manifested as, I have a headache, I have a stomach ache, my skin doesn't feel right. But underneath all of that are really true mental health symptoms. For many years, I was the director of the school nurse credential program at our university, and the trend and change from the school nurses coming in and saying, I need to learn more about how to support children with diabetes in the school setting, to I need to know about mental health. The number of children coming in with anxiety, high school students talking about suicide, has quadrupled, I would say, over the last 5 to 6 years. Significant needs there that aren't being met. I'm
gasping at that number that you just shared, that it's gone up that much and that it's that level of severity, that it's gone from Susie isn't wanting to sit with me at lunch to I think I don't want to live anymore. That's pretty dramatic.
Yes. And it's frightening because if there aren't community services or partnerships with the schools for mental health support services, there's often very little that the school nurse can do besides using mindfulness, gentle, caring, and trying to take a teachable moment and reach out to parents. But it's pretty limited based on what the needs are.
Yeah, when you mention that with the school health, when I was living and working in New Zealand, the number of children I saw with bottle rot. I understand that it's growing here in the States. What's been your experience with that?
First of all, there's just a lack of awareness. Certainly, there are some groups and cultures that think that the baby teeth, they're just baby teeth, so why would you do oral health that way? We know that it's really important to take care of those teeth and to prevent cavities and mouth infections because they pave the way for the permanent teeth to come in. But I started a donation project with dentists in the Sacramento area and also a way for them to see kids without dental care on Saturdays for free, because I would ask kids every time they came in to see me for whatever reason, do you have a toothbrush at home? I was shocked at the number of times I was told, no, I don't. And I gave away thousands of toothbrushes as a school nurse and had a little toothbrush bear and talked to them about the importance of brushing their teeth. And, every few months I'd say, hey, you probably need a new toothbrush. It is a very neglected part of the public health issue. And I think nurses in many ways in the community as well as the hospital are important that we partner with dentists and dental hygienists and other healthcare professionals to bring this message forward.
So to your point, that great divide, how on earth did the mouth ever get separated from the rest of the body and the rest of our healthcare? I have read some of the history of where that originated from, but we have moved so far away from those sets of circumstances and we're too smart. How is it that it persists?
I think it's changing. I think, for example, there's been a pretty robust program put out through the federal government to help primary care physicians, nurse practitioners, and PAs consider oral health and get training in oral health as an essential part of primary care. It's having a reach. It has a lot further to go. I think there's been a general lack of awareness on the part of medicine, how important the mouth is. The new studies we have coming out about the microbiome in our body in general, and some of the new physiological studies I think are changing the idea and direction about that. So I'm pretty optimistic that things are going to continue to get better in that way. And the counterpoint of that, too, is dentists realizing the role that they have in overall health. My dental hygienist now takes blood pressure. What a teachable time. I mean, why not? She does a little health survey and she takes blood pressure. And if it's high, she refers you back. Dentists could certainly ask patients if they're having surgery. Oh, did you know when you're going into the hospital you need to keep brushing your teeth? Here's your surgery oral care kit. They could be looking and working with the maternal child care providers about the importance of oral care through continued partnerships. There's lots of potential, and I think there's a lot of things being done, and we are seeing a shift.
So I hear very strongly that clinician mindset that you have and the educator mindset, and now I'm hearing that innovator mindset come out. As somebody who's driving improvement and innovation, what are some of the lessons that you're learning as far as, you've identified you need to have many partners and going cross-sector, moving earlier and upstream. What are some of the other lessons that you've learned either the hard way or the easy way in how to drive an innovation forward?
Thinking about innovation, and when it dawns on you that you've come up with a new idea, you have an innovative approach. I'm a nurse and I have something to say about this, and I am an innovator. And how do you move forward with that? One of the most important lessons that I've learned is to be persistent and passionate. You're going to get yeses, but you're very likely to get a lot more no's. That doesn't make sense. Why would we do that? Prove it. That's too simple. I'm just trying to think of some of the things that I've heard. I even had one person tell me, well, patients have to die of something. Isn't pneumonia a good way to die? Yeah, exactly. And just those types of things. You have to be prepared to be strong and persistent and not take no for an answer. I can remember one day waking up and thinking, this is hopeless. I'd had so many conversations with people at the national level. I even had a very high level, very high placed person in a position of power to make a good change tell me that because they personally had never had a patient have pneumonia in the hospital, that they didn't think it was real. Despite all the data, despite bringing these reports forward from the CDC, and therefore wasn't going to do anything. And then I remembered to never give up. And then I remembered the first patient I saw die from hospital-acquired pneumonia in the hospital, a 53-year-old grandma, and having to sit there with their family and say, your mom came into the hospital for a simple surgery to get better, and now she's died.
Something that was preventable.
And I'm getting goosebumps right now, and that vision stays with me. And I won't retire until something's done about this, because too many people are dying, too many people are losing their loved ones from something we can do better at, if we know and if we have help to do it.
And as the historian, what lessons have we learned historically and from the history about taking an idea and moving it to impact?
When I began my nursing career and thinking about what do nurses do, what's the role of nurses, it never really occurred to me to take on leadership and innovation and step forward with what our profession can offer the entire system of healthcare. And I think that has really changed for me. Nurses are directly involved in leadership and innovation and partnership to move these things forward. We have a big voice, and we have an important voice, again, in partnership with other healthcare professionals. And that's been a brand new way of thinking for me, I would say, over the last 15 years in my career. When I've looked at the history of nursing, particularly issues like this, it excites me to think about all the different ways that nurses have taken their knowledge into the most amazing regions of the world, into the most dangerous areas of the world, into the war theater, and use their profession to promote health, restore health, and allow for peaceful death. It's inspiring, and every time I look back and look at ideas from history where nurses have been, I gain new passion and a new resolve in myself to be one of those nurses that can make a difference.
Bless you. Bless you, bless you, bless you. And may you have many more years of good health and a good cognition, because we need strong thinkers like you, and we need big, bold hearts. So I really appreciate the time you've taken to be in conversation with me today, as well as all of the work that you're doing. And I'm looking forward to making sure that people really understand the power of the toothbrush.
Thank you. And thank you for putting these podcasts together. You know, it's going to be so important to the nursing profession.
Dian Baker is a professor, nurse researcher, and former school nurse. You can find more information about Dian, along with more about the Rush to Brush program, in the show notes or on our website, seeyounowpodcast.com. This conversation reminds us that we just can't take a point solution approach to healthcare. Instead, we have to look at the health ecosystem and actually the body as a whole, all of those parts working together. And as simple as a fix might seem, real innovation comes by making those simple solutions work in very complex systems. Oh, and by the way, please make sure to brush your teeth. For See You Now, I'm Shawna Butler. Thanks for listening.
See You Now is created in collaboration with Johnson & Johnson and the American Nurses Association. Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. You can help millions of people find this podcast by downloading and subscribing to See You Now wherever you get podcasts. To learn more about See You Now, Johnson & Johnson, and the American Nurses Association, go to seeyounowpodcast.com.